City volunteers in Damtree, Taiwan cleaned the home of a solitary senior and solved his utility problems. Businesses and individuals in Malaysia work with Xizhi to provide food care for residents in need. Welcome to DaAi Headlines. I'm Jenny Lee. Thank you for joining us. In Sanzhi District, New Taipei City, 75-year-old Mr. Xiao used to be a sanitation worker. After retiring, his physical condition gradually declined and could not tidy his house. Mr. Xiao's niece could not bear to see her uncle living like this. She sought assistance from Social Affairs Bureau and was then referred to Tzu Chi.
After installing a light in a dim room, the volunteer started cleaning as she sprayed alcohol around.
Now he is at an elder age. His health is relatively poor. His niece is very good. She is concerned about dengue fever in summer and also the pandemic. As his house is very chaotic, she worried he would get infected.
Frankly speaking, thanks to the Social Affairs Bureau, otherwise I don't know who to call for help. They introduced Tzu Chi to me, so I contacted the volunteer as soon as possible. And you guys are also very active. Thank you very much.
The volunteers from Tamsui District brought their own cleaning tools to help the solitary 75-year-old Mr. Xiao clean his house. Living on a slope which is far away from the main road, he has accumulated much debris in his house over the years.
During the cleaning process, a lot of small animals like little cockroaches and little mouse ran out. Basically, we won't be afraid. We're very determined to come here today to help the care recipient do these things. We're willing to give.
The lighting in the kitchen and bathroom, as well as the water tank, were damaged. In addition to repairing them, volunteers also installed handrails for him. With poor health, the life of the solitary elders is not easy. The family and the community should care for them more, giving them peace of mind.
For elderly and people with limited mobility, having a living space equipped with handrails and grab bars is imperative to their safety. Bathrooms and stairs are dangerous places where most slips and falls occur. City volunteers in Xizhi District use their professional skills to examine the households in need and install handrails in high-risk areas.
To install handrails that improve the safety of a home, professionals need to first inspect the walls.
Before we do any work, we first have to knock on the wall to see if there's a bulge or a hollow space behind the tile. If so, we try not to drill the wall, because drilling it will cause it to break and it will not lock down.
Yu Seng-chuan was an electrician and plumber, found that when he was helping Zhang Jiaoxi replace a water heater at his home, there's no handrail in the bathroom, which made this impaired resident slip and fall countless times in the past 13 years. Care from the Dharma family helped avoid serious injury.
A lot of people with physical impairments or even elders are at high risk of getting injured in the bathroom. At least for me, the risk of this work lets me feel more confident and safe in my heart.
The main thing is that we do this according to their needs. They really need us to do it. This let him feel something practical words, which makes sense. You can see it's useful right away, and he actually uses it, and it feels very safe and convenient. That's our biggest reward.
Prevention is better than a cure. These handrails in the home are a blessing for those who suffer movement impairments or other illness.
In Tainan, Taiwan, Dacheng International Incorporation is promoting vegetarianism. The company founder is aware that medical workers are extremely busy, so he leads his employees to prepare and deliver 1,200 vegetarian lunch boxes to Dalian Tzu Chi Hospital. Let's see how they do this.
40 employees and volunteers start working early in the morning in the large and clean kitchen. They're preparing 1,200 lunch boxes to be delivered to Dialysis Hospital, which is 100 kilometers away.
We pay attention to the colors and nutrition. We also place a hot water bed in the boxes, so 3 hours later, the temperature of the lunch boxes is still very hot. We do not dare to turn on air conditioner during food preparation. The company also rents a van so that the temperature of the lunch boxes can be maintained.
Lunch boxes need to be kept hot while apples are fresh. We place them separately, maintaining their temperatures as we deliver them to Dialysis Hospital.
They take off after packing the lunch boxes. After an hour, they reach the hospital.
After eating the vegetarian food they prepared, we cannot forget the taste. They deliver the hot lunch boxes to the hospital so we can feel warm in our hearts.
We work in the support unit, but in the medical system, we work with one heart. We eat vegetarian food to protect the earth.
Meanwhile, the kitchen established by Xie Rongkun has been delivering more than 80 hot vegetarian lunch boxes to local solitary seniors every day for more than 10 years.
We understand that the hospital restaurant lacks resources. It is no big deal that we are promoting vegetarianism. Seeing that they have needs, I can tell people we eat the food, feel good about it. Otherwise, I would not do this. After 3 hours, the lunch boxes are still hot when they eat them.
To ensure that the medical staff can enjoy tasty, environmentally friendly vegetarian food, he delivers 1,200 vegetarian lunch boxes to us. He hopes we can be healthy.
The company's staff has built up good reputation while delivering vegetarian food. They will also support the medical workers to enjoy vegetarian food on the 1st and 15th every month.
The Kaohsiung city government cooperated with Tzu Chi to care for solitary elders. Volunteers found an old man living in a house where the ceiling was on the verge of collapse and the door could not close properly. In addition to helping with repairs, volunteers also cleaned the kitchen and bathroom so that his home would be safe again.
When we first came in, the lights were dim. The ceiling over the hallway collapsed and was nearly halfway down.
To remove the collapsed wooden ceiling, wearing a safety helmet is necessary. There are many more problems inside.
There are many problems with the house. The doors on both sides of the house inside were missing.
The damaged side door was also reinstalled, but there was still work to be done on the house. Xizhi volunteers assisted a 78-year-old elder living alone renovate his home. The top floor was leaking and a layer of waterproof protection was added. The ceiling saw exposed steel rebar, which was reinforced with sheet metal. After the repairs were over, volunteers started with a second wave of work. From the range hood to the pots and pans, volunteers vigorously scrubbed the tiles in the kitchen and toilet till they were sparkling clean.
Let's work together to help him clean the house. Let's show him some care and compassion. This is my intention.
These sincere actions left a deep impression on an old man who is not good at expressing his emotions.
There will be no more water leaks in the kitchen. Am I happy? Yes.
When the Level 3 epidemic alert was announced in Taiwan, long-term care program was temporarily put on hold except for patients who live in nursing care systems. Visits to care homes were banned, so nursing staff often use video chat to keep patients' families in touch with residents. In today's report, we take a look at how care facilities and in-home care have adapted under the pandemic.
Hi, Hansen. 妈妈好想你哦！好，这个时间点爱滚。
没呀，你就清楚了吧，妈妈。
有，好清楚哦。韩琛，你胖了耶。
Achin looks like he's fallen asleep, but he's actually been in a vegetative state for over 10 years.
有了，眼睛打开了，妈妈。
有啊，有听到妈妈的声音了哈。那种心情是。
Doing video chats with him, I'm happy, but also kind of sad.
The Level 3 pandemic alert in Taiwan has meant that nursing homes are closed for visitors. This was lifted finally in July when the pandemic alert levels was decreased.
琛，琛呢？妈妈来啦。我们2个多月没见面了呢，你有想妈妈吗？ 他的床我没有撤掉，我睡他的床。
This is his bed. I didn't get rid of it. I sleep in it now. Whenever I get in, I think about him. Before I sleep, I will think about all the times we spent together, from when he was a baby until now. Then I will be able to fall asleep.
On this day, the hallway at the nursing home has become a walk down memory lane.
那我们来看画。其实韩晨以前也蛮会画画的，有时候就会画几张给妈妈看。
On the average, people think those in a vegetative state just lie there and are unconscious. But after taking care of them for so long, we know they experience all the human emotions just the same.
The Genesis Social Welfare Foundation has 17 nursing homes across the island and is home to about 780 patients. However, in all of Taiwan, there are still about 2,000 patients who are in other institutions or being taken care of by their family members at home.
We hope the family members can easily visit their loved ones with care they are comfortable with. During the pandemic, disinfecting steps, such as the doorknob or floor, are done during each of the shifts, what normally we might have just done once a day.
Nursing care worker Luo Caiyun has worked at the Genesis Social Welfare Foundation for 21 years, and her ancestral home is in Yunlin. Since the level 3 pandemic alert was announced, she hasn't been home in 2 months. She can only video chat with her children after work to ease missing them.
你在做什么？我要在5天再回去哦，哈，你有听到吗？如果再延后，你会难过吗？那你要乖乖哦，有听到？跟家人就是聚少这样子。
I haven't seen them much since. Mostly I use video chatting or the phone to keep in touch. This way it protects the patients here and my family as well.
Nursing care attendants sacrifice their life outside of work and also have to face budget restrictions.
On average before the pandemic, our branch averaged 220,000 receipts, but in June, the first month of the level 3 alert, there were 100,000 less. In total, all of the branches received 2 million less receipts that month. If one receipt could gain us 1 NT dollar, then this means we're out of 2 million NT dollars donations a month.
Although there is a decrease in donation, the long-term care program cannot be reduced, especially for those living outside the nursing home, such as this patient whose life is seemingly like a candle flickering in the wind.
Last year, I was in the bathroom for just 5 minutes. My legs gave out. I fell on the floor. I had to yell really loud until my neighbor heard me and called for help. I sit here most of the time. When the home care attendants are not here, it's tiring and frustrating because I'm not active. I know when a person sits for a real long time without people to talk to, their brain function starts to decline. I end up just talking to the TV.
回来准备哦，好来，接，喏，好，好，好，再等，好来接，2、3，好。
I take him out on the balcony or outside to rest and walk a little. I want to ease his nervousness and insecurity.
The home care workers have a strong bond with the elderly they take care of. They treat them like family and are very willing to help them out.
No matter if it's at-home nursing care or institutional nursing care, these services cannot be stopped. Though the pandemic has eased a little in Taiwan, it's not time to celebrate, but instead to empathize with those in society that are still suffering.
Malaysia has been hit hard by the pandemic. Many families find it hard to make ends meet. Tzu Chi Kuala Lumpur and Selangor chapter launched the food care program and set up more than 40 distribution sites to provide fruits, vegetables, and dry food to those in need. The event has inspired many people to do good deeds. Among them, an employee of a company called on his co-workers to donate rice, working with Tzu Chi to contribute to the community.
This truck of rice was going to be sent to Warang, Selangor for food care distribution.
We have asked him to deliver the rice to the distribution site, yet we are surprised to learn that he has helped us raise enough rice for distribution.
Zhong Xiaowen has been calling for co-workers to donate rice for 3 consecutive weeks.
The response was very enthusiastic at first. About 20 people responded to the event. Some even donated money for 4 consecutive weeks. During this pandemic, if our company can contribute our part to help people in need, we're very pleased to do it.
During the pandemic, Tzu Chi Kuala Lumpur and Selangor chapter launched a food care program to care for the community. 40 distribution sites were set up to provide fruits, vegetables, and dry food to people in need.
Going to 1 year already. Since this COVID came, then no more already, no working already. Because he got stroke, so he got soksola. So that one we use for makan lah.
I ate 2 meals a day with rice and vegetables and fried eggs only.
Jalishmi was unemployed due to the pandemic. Her husband and younger son fell ill, making her life even worse. A family of 7 relied on the income of one of her children.
We eat simple food, sometimes just instant noodles. My youngest child is 9 years old, and his name is Zhang. He suffers from heart disease, so he needs to go to Salayan Hospital and the National Heart Center often, about 3 or 4 times a month.
At the distribution sites, epidemic prevention measures were strictly followed. There are volunteers coming to do disinfection every week.
We don't want to spread any cluster infection or infect our volunteers. Disinfection is very important because we need to help others. At the same time, we also need to disinfect ourselves.
Under the pandemic, everyone contributes their efforts to tide over these difficulties together.
The pandemic situation in Malaysia is still not under control as each state experiences a surge in confirmed cases. One of the states, Perak, has 62,000 confirmed cases, stressing out local hospitals while causing a lack of medical resources. Tzu Chi volunteers arrive at the hospital to provide oxygen generators and Jingsi folding beds. Here's the story.
Tzu Chi volunteers unloaded supplies fast. The boxes of oxygen generators are meant for this hospital in need of medical equipment.
We have oxygen support from the hospital, but now with the increasing numbers of patients coming in for COVID, I guess this support of Xizhi is very, very thankful to them.
Near Selangor, Senaman Datang Hospital Slim River also takes in COVID-19 patients from both states as hospital lacks medical resources.
Our hospital has a lot of patients. Half of the patients are from Perak and the other half comes from Selangor, so we actually lack medical resources.
We'll ask the hospital directly. They need medical equipment. Although it's risky, if it's the right thing, just do it. So us Tzu Chi volunteers must walk into the hospitals, or else we wouldn't be able to help them.
Besides the 2 hospitals visited, Raja Permaisuri Bainun Hospital's ICU department faces a lack of medical beds and oxygen generators. Volunteers immediately gathered Jingsi folding beds as a solution.
When the hospital staff saw our Jingsi folding beds, they were very happy. We demonstrated the know-how of Jingsi folding beds. We also showed them how to turn the beds into a chair. It can have up to 4 people sitting on it. This is to make them feel more at ease.
Under the pandemic, Tzu Chi goes hand in hand with frontline medical workers, overcoming tough times together.
In Malaysia, due to the pandemic, hospitals are facing a shortage of dialysis machines. Therefore, Tzu Chi Kuala Lumpur and Selangor chapter have donated 4 dialysis machines to University Malaya Medical Center to safeguard patients' health.
Dialysis machines donated by Xizhi Kuala Lumpur and Selangor chapter to a hospital have been packed in paper boxes. Among the 4 dialysis machines, 1 is for dialysis patients in the ICU. Currently, there are 40,000 dialysis patients in Malaysia. Due to the pandemic, hospitals face shortage of dialysis machines.
We have 14 dialysis machines. We spend 4 hours serving 1 patient. So, we have 3 working shifts. In COVID-19 wards, There are 24-hour shifts. We switch patients in every 4 to 5 hours.
Due to the pandemic, patients are on different floors. You cannot insist that they are all on the 8th floor, so we need to provide dialysis in different wards. We had 1 point, which is not enough. We have now opened 3 points.
Many of the deaths in our hospital that time are from the hemodialysis patients. So then I remember someone that I knew in Tzu Chi, that's her. So I text her, I say, hey, can you please help me or not? So then communicate with the Tzu Chi, and here we are. We got 4 dialysis machines within a week of discussion. That is amazing. Thank you very much.
As pandemic situation in Malaysia is serious, Xizhi Kuala Lumpur and Selangor chapter has initiated online donations to purchase medical equipment.
1013. Because in Chinese called 一人一山, but in Malay it's the orang seamal.
Like what I just did, it takes less than 30 seconds, so I think it is a very good way.
As everyone gathers their kind thoughts, the cycle of love will continue to expand.
Facing the deadly COVID variant, COVID cases have been on the constant rise in Malaysia. As students are not able to go back to physical classrooms, they must continue their studies online. Upon noticing the need, Xizhi volunteers brought second-hand computers to care recipients.
Though the movement control order is still in place, Xizhi volunteers made plans to visit care recipients.
Because of the scholarship program, we want to provide children with computers so that they can learn properly. We must come out to help them.
Opening the computer, and after volunteers taught children the basic usage of the device, children can now properly learn online.
问朋友，用电脑问朋友。
然后呢，是什么问题？
现在手机坏掉。
那你现在会讲？
用这个电脑来上网，来做功课。
In the past, I used a phone for online classes. It's very inconvenient because words were too small. I had to enlarge the words constantly. After receiving the computer, I felt very happy. I look forward to the day I can use it for online classes.
Li Hongda is from a single-parent family. As his mother makes little income, the family can only afford 1 computer for the sister to use. Being a filial son, he understands his mother's struggles. Though it's quite tough to use a phone for online classes, he never complained.
用手机上网课的感觉是怎样？
就屏幕很小哦，看了很辛苦。
那天你看到师姑这样子拿着一架电脑来你家要给你用哦，你的感觉是怎样的？
是有吓到啊，惊喜这样子哦。
让学生借用电脑啊，
We lend computers to students so that they may be more focused during online classes. They will also develop interest in courses.
也对老师的教课会比较感到有兴趣。
With the computer, these students are no longer bothered by a lack of proper equipment for online classes. They can now catch up with the class and continue their education.
In the Philippines, Tima and Xizhi volunteers continue with the vaccine inoculation up to 8,000 persons per day. A Xizhi family shows their support for the frontline staff by providing pasta and fresh coffee on site. Thank you for watching. See you next time.